Friday. We are keeping up with the track and trace, which is really important. Josh and the team, we've got a good contract out there, so folks are able to follow up. Our local departments of public health are following up. We now have over 1 million people who have signed up for that Google app, which is amazing. COVID Alert CT, they will inform you immediately. And if you put in the code, they'll inform anybody you've been in contact with. So that's how we're keeping up with track and trace. 116,000 tests since Friday. We still are, top 5 in the country in terms of testing per capita. Allows us to stay ahead of COVID. 6.3% positivity the last 3 days. That's down a little bit for the last 3 days, but we're still about 7% for the last week. And so like a couple of weeks after Thanksgiving, we came up a bit. Now it's a couple of weeks since Christmas. We've come up a little bit. Fortunately, it's going up like this, not like this. So we feel like we've got it under control for now. A lot's happening over the course of the next couple of weeks. Kids going back to school, universities slowly getting back into kids flying back. So we have one more chance where the Whirring Blenders start stirring things up. I would tell the universities, I would get all those kids on the COVID Alert CT track and trace app. I think it would just be a big savings for folks. Hospitalizations relatively flat over the last few days, at least still good capacity, as you know, and tragically 92 deaths over the last 3 days, a trend that is just heartbreaking. The vaccine update, which is always a little more hopeful. We still are one of the best in the country when it comes to getting people vaccinated, that first vaccine on a per capita basis or percent of the population. That's really important. We've done about 140,000 vaccines have been administered since we started. Almost half of them, 42% of them, just in the last week. So I would tell all of those frontline healthcare people in the nursing homes and in the hospitals, overwhelmingly, you've gotten vaccinated, but some of the nurses have still been a little hesitant. Here's your chance. Schedule your appointment now. Stay at the front of the line. What a difference that can make, because we're beginning the transition to the next group of people. And as the flow of people comes in, I would take advantage, healthcare people, of getting to the front of the line and getting that vaccination. Don't put it off any longer. Next up is phasing into 1B, is what I was alluding to before. So we're going to make sure that there are no vaccines left on the shelf at the end of the day, at the end of the week. So what Pat can tell you at Griffin and our other providers, we're going to now open it up starting next week to people over the age of 75. These are over the age of 75, not in the nursing home, but in the general population. Folks over the age of 75, there may be about 5% of our population, but they are about 60% of the fatalities. You can see why the CDC, Center for Disease Control, and the state of Connecticut are prioritizing this group as we move from just the 1A to the 1B as the first tier there. So look, starting Thursday, just in a few days, we're going to start the advanced registration for people over the age of 75. And a medical outreach to those patients. Pat can tell us a little bit about how that strategy is, how we'll be reaching out to you. Following up, there'll be online registration as well, so that you'll be able to sign up and make an appointment. And I've got to tell you, there won't be room for everybody on day one, so you're going to have to be patient. And for those of you who just are a little exhausted by the internet and online, we are going to have a telephone booking system as well. Details on that coming out in a couple of days. So that's in 1 week, the 75 and over. So start being able to register for their vaccination, and that's really important. Looking forward. Looking forward is we're anticipating an expanded supply of vaccine over the coming months. We want to make sure that we have in place the infrastructure to be able to do that. So Josh is working very closely to expand our provider base, starting with our hospitals, our federally qualified health clinics, moving into mass or broad-based vaccination sites. The first one up, again, will be Rentschler Field, probably in the next 10 days. So you'll be able to go to Rentschler Field, and you'll be able to, A, with an appointment, get vaccinated, B, get tested, and C, as needed, depending on need, be able to get some food support as well. So that's where we'll be able to do that at Rentschler Field. I think the federally qualified health folks are taking care of that. Convention Center, Hartford Health is doing it there. And I think Josh is going to say we'll have another half dozen other facilities being able to do this on a broad base within the next couple of weeks. But that's not good enough. Not everybody has a car. Not everybody has easy access to a site like that. So we're also going to be rolling out the mobile vaccination units, just like we did with testing. So we go to those underserved populations. It's so important that they get tested. Now it's so important that they get vaccinated. We're going to make that easier for you, working again, for example, with our houses of worship and taking advantage of their parking facilities so we can bring a mobile unit there, come out of the service, and get vaccinated. Working very hard to do that. What do we need? We need additional supply. Just got off the phone with somebody on the Biden task force. They do believe that the millions of doses that are sitting on the shelves waiting for the second dose will be released to us as a first dose opportunity soon after President-elect Biden is sworn in. We are expecting some guidance, Pat, in terms of whether you have to do that second dose after 3 weeks, or maybe there's a little bit of latitude there that would give us some more flexibility. But you are going to have to get that second dose regardless. So that's what we're trying to balance out over the next few weeks. And that's how we can increase supply, get more of you vaccinated faster. And we are hoping to see Johnson & Johnson get approval maybe by the end of this month. One of the small choke points we have is still getting more people able to vaccinate you. It's the people issue that we have alluded to before. So if that's your thing, go to ct.gov, Step Up Connecticut, ct.gov, Step Up Connecticut. It's working pretty well. I mean, I think we've had thousands of college students sign up so they can go in as apprentice teachers and help our kids get back to school safely. And for those teachers that have to teach remotely, we still have somebody in the classroom. I think we have over 1,000 people who have signed up for our medical reserve team, and hopefully some of them can be trained or are qualified to give vaccines. We've got a lot of retired folks who are coming back. I think they've done a few vaccines in their day, and they'll be ready to help us out as well. Again, let me just reiterate, please be patient. I mean, I think you've seen the pictures from Florida and other places. First come, first serve. Everybody over the 55, come and join. That's not the way it's going to work. And there are more disappointed and frustrated people in those states that have done it that way. So we've got, obviously, a lot more people want to get vaccinated, a lot more people over the age of 75 that are ready to go. And we're doing this by appointment. We're doing this carefully just so we can measure the flow in. It's not a question of how big I expand 1B. There's only so many vaccines, but we're doing everything we can to do that. So that's why I urge you, please be patient. We're going to get this out as the best as we can, and keep your guard up. I was struck today to find out that because of people wearing the mask, people diagnosed with flu going to the hospital for flu is down 95%. Pat?
Unmute.
Yes, Governor, we've seen that here too. The number of flu cases at Griffin is down dramatically, which is wonderful only because it creates capacity to care for the number of individuals who are presenting with COVID. Just in terms of vaccination, I want to thank you and the vaccination program leadership team who've done a great job in rolling out the program here in Connecticut. We've had a really positive working relationship, which has allowed us to vaccinate over 10,000 individuals to date, and that's just since the 15th of December. That's been the phase 1A group. which is direct caregivers. We've not only done that for our own employees, but for employees of other healthcare facilities throughout the region and the state, and have now done some on-site vaccination for state employees in facilities, and those are direct caregivers there. We're really looking forward to next week, where we have an opportunity to vaccinate those 75 years of age and older. We've already been preparing for this. We've identified vulnerable individuals in our community, working with our local anti-poverty agency. We've mined data through our own medical records in our integrated physician practice in our hospital, trying to identify individuals that we need to get to first, especially those who will have difficulty coming to a vaccination center. We're working with our parish nurse program, our community health workers, our outreach workers to identify those individuals and develop a plan to go and vaccinate them where they are. We're working with the local interfaith council and the local clergy to see if we could use local churches, church basements, at least to work with the clergy and church leadership to identify individuals that might be at the highest risk. We are setting up a call center. We know that there may be challenges with access to technology. So we are actually going to be calling those individuals we've identified that we need to get to and schedule appointments with them so that we can get them vaccinated as soon as possible. I concur with you. There is a concern that if we open it up as first come, first serve, we wouldn't be able to manage the demand. And I think it would create a negative scenario, will discourage people from coming out. So a more disciplined, structured approach, we believe, will work. We're looking at various locations, want to make sure that people have transportation. Luckily, our local anti-poverty agency can actually provide volunteers to drive individuals to vaccination sites if they can't get there on their own. Again, our focus initially will be on those individuals at highest risk, those that are low income, those that are currently on Meals on Wheels, those that we know have multiple chronic conditions, because as you pointed out, those are the individuals that have the highest mortality if they contract COVID. So we want to get them vaccinated as soon as possible.
Hey, Pat, I'm 75 years old. I live in Derby. It's a week from now. I haven't heard from anybody. What's going on? What should I do?
So if you live in Derby and you're 75, in the next day or two, you will begin to hear from us. So I know everybody's been standing by. We've gotten lots of calls to our call centers while we're in phase 1A, asking, when they're going to have an opportunity to get vaccinated. People have been patient, but I think we got to get the word out. So I think multi-pronged communication is going to be important. Again, we're actually going to be calling people directly. Obviously, we're going to communicate through existing relationships, our health and social service agencies, our local health department, but the actual call to schedule the appointment will be an outreach call. So we'll call them, and we want to do that as quickly as possible.
I love it. Pat's here to answer any questions, along with Josh and Paul. Max?
Channel 3 Eyewitness News.
Yes, Governor, talking about the vaccine rollout, it looks like there's going to be tiers within the tiers. We see 75 and older going first. Who in Phase B would be next?
Well, the allocation committee, we put together, will be meeting tomorrow. They meet very publicly on a CTN, so you can listen to the debate. We're following the lead of CDC, the Center for Disease Control. So they're going to lay out the other groups as they come along. But as Pat just suggested, after the 75-year-olds, it'll be people with some healthcare risks and frontline essential workers.
Got it. Talking about sports now, high school sports, the preliminary guidance has been released. It looks like certain sports are going to be going back on the 19th. Does this also apply to recreational leagues and groups and ice rinks and things like that?
Yeah, we're talking about K through 12 here in terms of those sports, but I also think it does apply to those leagues. I think you can see maybe the chart up here. We wanted to bring this out that we're about a week away from allowing practices to begin for all those moderate risk sports. That's ice hockey, basketball, indoor track, swimming, not wrestling, I'm afraid. And the competition can begin very soon thereafter. And working with all of our neighboring governors, I think we announced this probably a month ago, we're not going to have, interstate competition just because of all the flow of people back and forth. It looks a little risky.
If I may, briefly on security, the FBI put out an alert about the potential of armed rallies, protests happening at every state capital. Are we hearing about credible threats or credible details of this happening in Connecticut?
I can tell you our state police, working with their national counterparts and working on a regional basis, are tracking the social media very, very carefully. And so we'll be ready, but I have a high degree of confidence that Connecticut's going to stay peaceful.
NBC Connecticut.
Hi, Governor Matt Austin with NBC Connecticut.
Hey, Matt.
Just following up on that, has the Connecticut National Guard been requested to go to D.C.?
Why don't you take that, Paul? You're on mute.
Hold the pat. Sorry about that. Yes, the Connecticut National Guard has been directed by the governor that upon requests that come into the Connecticut National Guard that we stand ready to provide support to our partners down in D.C. At this time, there has not been any additional requests made, while some of our regional states who have other applications for specific requests that they were able to take on, particularly New York. But Connecticut and the Connecticut team of the National Guard stands ready upon any additional requests being made.
And is there a certain number of guardsmen who have been told to be on standby?
At this time, we have no particular number. It all depends on the particular ask that's made by the National Guard Bureau.
And is the Guard also on standby to protect potentially the state capitol?
The governor always stands ready to call in the Guard for any particular emergency situation.
Okay, thanks, Paul. And Governor, just kind of switching back over to COVID, for these people who are age 75 and older, and if they don't get contacted by somebody about vaccination, are there the state numbers and the state website, is that where they should head to? And where will they get vaccinated? Will retail locations like CVS and Walgreens be open for vaccination?
Yeah, I'll start with that. I mean, we're going to be releasing all that information, numbers you can call, within the next 72 hours. And Josh is working very closely with CVS, Walgreens, and the other pharmacies. Let's face it, CVS and Walgreens are pretty busy getting the next stage of people vaccinated at the nursing homes. That was their first priority. But over the course of the next couple of weeks, I think you'll see more pharmacy retail outlets available. Of course, the hospitals and the federally qualified health centers as well.
Yeah, just picking up on that, we already have over 100 locations around the state that are doing vaccinations. So there will be a location close to just about everybody in the state at this point already. And the key point the governor touched on before is this is going to be a reservation-based process. This is not first come, first serve, people camping out overnight on sidewalks. So, our hospital partners like Pat and his team and his peers around the state are starting some outreach to people who've been in their networks over the past several years to do some outreach. By Thursday, as the governor mentioned, there'll be a website, there'll be a phone number for people to call if you haven't heard from someone or you want to take the initiative to book your own appointment. Those options will be available. And so at both of those locations, there will be visibility into what sites have appointments, what times. You book your slot and be ready to go. The key message here, though, is it's all appointment based. We don't want people showing up at vaccination sites. You won't get a vaccine if you just show up without an appointment. So keep that in mind. But there'll be it'll be very clear for folks how they can book their appointment in the coming days.
Okay, thank you.
News 8.
Good afternoon, everyone. Governor, when you mentioned we know that the most vulnerable group, right, will be up first. You mentioned the mobile ability or aspect of this. Will that really help those that are the most vulnerable to be able to get them out there and have access?
Yeah, absolutely. There are a lot of people that just can't access by car. And a lot of those folks are the most vulnerable. Many of them live in very congested housing. We found with testing that they're the ones where you could see a great spread of infections. It's very important that they be prioritized in terms of the vaccine. So that's why with those mobile vans, we'll be taking the vaccine to them.
And then with respect to the outreach call, we're hearing a lot about these scammers. So if someone is being contacted, how will they know? What's the best information for them so they'll know what to look for so they know it's not a scam? I'll
start, then I'll pass it to... If they ask you for your credit card number, if they ask you for your passport, if they ask you to send cash, hang up the phone. They're not for real. You can give a little more detail.
You will. No, the vaccination is free. No out-of-pocket cost to anyone. You will not be asked to pay for a slot to book a reservation. You would never be asked for any kind of money. So if anyone's asking for that, that's a giveaway that it's a scam. Equally, no one's going to ask you for your Social Security number. Don't give away your Social Security number or a credit card number to anyone. Those are other tells. And so, if you see that, that's a good side of a scam. We put out a press release earlier today with some other tips and tricks as well.
Just one more, if I'm able to. How Connecticut ranks ahead of most states in terms of vaccination. How much of that is certain groups, say like healthcare workers? Maybe you were expecting to have more healthcare workers that had COVID, and if you're not seeing that, has that helped in being able to get the vaccines out quicker?
I didn't track that, Josh.
I'm not sure I understand the question.
So I think that I heard something this morning that one of the reasons that Connecticut has been ahead of most other states in vaccinations is that one group of people, among those the healthcare workers, there hasn't been with the uptick, maybe not as many healthcare workers have been coming down with COVID. So with that being diminished a little bit, it's helped get out vaccinations at a much quicker rate.
Well, look, I think, our fast start on getting people vaccinated in this state is a function of, the great partnership I think that we have, the phenomenal work our team at the Department of Public Health has been doing, getting organized over the last several months, being ready for when the vaccine started to arrive, enrolling 100 providers, partnering with them to ensure they have what they need, doing the training, and the fantastic work of our providers, Pat, his team, his peers, the local health departments, federally qualified health centers. We've worked very well as a state throughout this crisis at every step with whatever the new challenge was, and this is just the next iteration of that. And I think it's really the partnership that's gotten us off to a good start. Pat, you should also offer your perspective from the front lines here if you have other thoughts on that.
Yeah, Josh, I agree with you. I mean, this is not a surprise in terms of our success with vaccination to date, because as a state, we've done a great job with testing. And some of the same infrastructure is being used. I mean, some of the capabilities that we're leveraging right now, we built as the state's largest testing partner. We've tested in 124 nursing homes, 4 state universities, state facilities, and in multiple drive-up testing centers. So the information technology that we're using, some of the scheduling and outreach capabilities were developed as part of the testing program. So again, good testing, I think, is leading to capabilities for vaccination. And there's real determination, and I want to reiterate the level of cooperation amongst the provider community and your office, DPH, the controller's office. There's been a really strong, positive working relationship, and everybody has a common goal, and we're getting out there and getting it done.
61.
Hi, Governor. We're still seeing a lot of activity following last week's incidents at the nation's capital. Are there any steps being taken at our state capitol or other state buildings to increase security?
Yeah, as we said before, our state police, working in conjunction with their national counterparts, are tracking the social media very carefully, working with any sources we have, making sure that we're ready for whatever could happen. And I'm counting on the good sense of the people of Connecticut that it's going to be safe here at the state capitol.
News 12 Connecticut.
Governor, I know the allocation subcommittee is meeting tomorrow, and you've deferred a lot of guidance to them, but they seem to really be struggling with whether to add people 65 to 74 to the next phase and younger people with serious pre-existing conditions. Again, just your personal feeling here, do you think those groups ought to be added?
Look, adding more groups just means other people get pushed to the back of the line. It's not like I'm increasing my vaccine capacity. It's not like I'm slowing things down in any way just because we're not adding more people. If everybody's a priority, then nobody's a priority. And I tend to think, on a personal basis, that both the CDC and our allocation committee have it about right. I mean, look, I'm in that, 65 and over. I can't quarantine very well, but a lot of folks my age group are a little better positioned to be able to quarantine. And there are an awful lot of, 45-year-old folks working at grocery stores and daycare who don't have that opportunity. They're there on the front line, teachers and the such. We want to make sure that they can continue to make our society run and do it safely.
And Governor, this might be a question for Josh or Paul too, but can you guys go into a little more specifics about what the security measures you're taking around the state capitol complex are now through next week?
Paul, you want to take that?
Yeah, while we don't like to go too far into what the security measures are, but I will just say in general terms, Commissioner Ravella and his emergency management team have been working with the Connecticut Intelligence Center, as well as collaborating with the Capitol State Police here on campus. There are assessments, security assessments that are being done on various state buildings as we speak. The governor is receiving daily security updates that will go all the way up to the inauguration, particularly with the information that we have seen not only from the FBI, but also from other sources monitored by the state police about actions that can potentially happen over the weekend. As the governor stated, the state of Connecticut, from a security standpoint, will be ready and prepared based upon any particular escalation that we see of these various actions at state-related buildings or state-related facilities.
Any specific threats or events that are concerning you right now?
Nothing that we could speak of at this time.
Okay, thanks, guys.
WTIC 1080 News.
If you're 75 and older, there's an extreme amount of anxiety on how this is going to go down. The Sunday Show did a piece on how bad it is in Florida with, grandma doesn't know what the deal, how much assurance can you give these folks that this is going to be more organized than what we've seen down there?
Well, I can give you a lot of assurance it's going to be a lot more organized. It's a reservation only, and you're going to be notified, as Pat said, hopefully, by the end of this week. So you know that you don't just show up, but you show up when you have an appointment, and we'll be able to take care of you. It's going to take a while. I can't do everybody in that first week, but I think you know where we're headed.
And as you've learned more, as we've learned more about what happened last Wednesday at the Capitol, it could have been a lot worse. Just maybe your thoughts on, what you've heard over the last few days and how, what you're thinking about it.
Well, it could have been a lot worse, but it was really bad. And it was a shock to our system that something like that could happen, that people would want to breach our nation's capital, that our representatives were at some physical risk, that the police were overwhelmed. We better learn and learn fast, because Sunday's coming up and there's a lot of people on edge who are using social media to gin up some hatreds. And they're not going to let that happen in Washington again.
Connecticut Public Media.
Good afternoon. In regards to Senator Murphy and Blumenthal have been talking about calling on the Department of Defense to investigate the slower response at the Capitol and reevaluate how the Capitol is protected. Has that crossed your mind to reevaluate how security at the Hartford Capitol works, and if there should be any changes for the future?
Well, go ahead, Paul.
Yeah, so just Allie, just for everyone, all the viewers, just so you know, while the governor's office is located in the state capitol complex is managed by the Office of Legislative Management of the legislative branch. So first and foremost, when it comes to the protection of the Capitol, while we're always able and want to provide the resources of the executive branch to support when it comes to security, particularly since the governor and the governor's staff work here, we always defer to the Office of Legislative Management and State Capitol Police when it comes to overall protection of this complex. So it's a long way to say, first and foremost, I would defer that question to the Office of Legislative Management and the State Capitol Police. But with that said, the state police and the governor and the governor's resources is always ready to step up to provide support in order to protect the people's capital of Connecticut.
Thank you.
The Associated Press.
Thank you, Max. Governor, I was wondering what types of, just to follow up on John's question earlier, can you talk about what types of communications you and your office have had with the federal government concerning these upcoming protests?
I don't think so.
Can you say that you've had any communications with them?
Hey, Paul, do you want to take that?
Dude, can you just ask the question again?
What communications have you had regarding
with the feds?
Violence with the feds?
With the feds, that has been led by Commissioner Ravella and his team, the state police and our intelligence center. They have been receiving daily updates from their federal partners, as well as participating in various calls and seminars based upon as information has come about. We do look forward to having additional information as the week goes along, as I said earlier, and the governor will be receiving daily security briefings from Commissioner Ravella for the rest of the week, all the way up to the inauguration.
Okay, thanks for that. And regarding, you mentioned Rentschler is going to be a mass vaccination site. Will there be other ones around the state, and where will these mobile units be located?
There will be others around the state. I also mentioned the Civic Center with Hartford Health. And they'll be in dozens of other, well, we already have 100 locations right now, Sue. And once we get our vaccination site launched, you'll be able to see that, and you'll be able to see where the closest place is to you, just like we were able to do with testing.
And the part about people being called at home, I'm just wondering, like, how do you make sure that people don't fall through the cracks? You know, I'm wondering, maybe they don't have a regular caregiver. Maybe they don't have some sort of relationship with Griffin Hospital or some of these other places. I'm just wondering how you make sure that someone who may be homebound, who doesn't have the wherewithal to know what to do, make sure that they don't fall through the cracks.
Hey, Pat, why don't you take that?
Yep, Susan, thank you. That's a good question. As I said earlier, so we have relationships prior to the pandemic with local social service agencies, with the local housing authorities. So we do a lot of community health outreach. We're doing screening in these vulnerable populations on a regular basis. So we're talking to the housing authority. So anybody who's a resident in congregate housing, whether they have an existing relationship with Griffin or not, those individuals are being identified. I mentioned Team Inc., the community's anti-poverty agency. They provide a whole array of social service supports to these vulnerable populations. So they have existing relationships. We're working closely with them. So they'll identify individuals they believe who fit the criteria, 75 and older, that are high risk. We're working with them. We'll be doing the same with local clergy, looking at their parishioners, their congregants. So we're not just looking at existing patient relationships with our physician practice or the hospital. We are reaching out to other organizations and agencies in government and our local health authority to identify these individuals. So where necessary, we're going to use their relationships to get to those individuals as well as ours.
Are other hospital groups doing the same thing?
Yeah. Yes, obviously we've been very focused on meeting the needs locally, but I've talked to my counterparts and they are using a similar approach.
Okay, thank you very much.
Hearst, Connecticut Media.
Thanks, Max. Pat, so how big is the Griffin catchment area? Is that the entire valley, or can you go into a little bit of that?
Sure. So our primary service area is 6 towns, and that's essentially the lower Naugatuck Valley. But at least in phase 1A, we've been vaccinating frontline caregivers from all over the state. And that's why our numbers are pretty high at over 10,000. We had capacity. We've got an efficient operation that's pretty high throughput. So folks who, when they went into the VAM scheduling system, once they've been registered, they can pick a vaccination site, and we had more appointments available, so folks came to us. So I think in part, Josh and the vaccination program leadership have reached out to us and said, you're doing a good job. Can you create even more capacity? So we have a mass vaccination site here on campus. A week ago, we were asked to double our capacity. And so starting on Monday of next week, we've moved to a new location going from about 600 a day here on campus to 1,200 a day vaccination capacity in our new facility. That's in addition, we're doing on-site vaccination. So we'll be out in the community, but in that single location, 1,200. There's been conversation about using our drive-through testing facilities, which we're using in communities throughout the state. So that's in Farmington, in Middlebury, in Naugatuck, in Trumbull. We're using those testing facilities 1 or 2 days a week. We're saying, well, you've got the facility built and the infrastructure, can we leverage those for vaccination going forward? So we're in discussions about possibly doing vaccination there.
Is it too soon to ask you where the 1,200 person a day site will be?
Yep, it's at 10 Progress Drive in Shelton, and that's will be adjacent to our occupational medicine center that has existing relationships with 900 employers throughout the region, a fairly broad region beyond the valley. And so we're working with those employers to identify those employees who fit the essential worker category in phase 1B. So we're ready to go with them as well. So it's not only the 75 and older population, which we're going to be focusing on in the next couple of weeks, but after that, getting to those essential workers that are qualifying for phase 1B.
Thanks. Josh, demographically, are people getting who are getting the infections skewing lower ages now? I haven't checked those numbers for a while.
You're talking about new COVID cases, not vaccinations?
Yeah, I'm sorry. Yes.
Yeah,
it's new cases.
Yeah, it's been following a pretty similar pattern over the last several weeks. It's pretty distributed across all the age deciles, but yes, there's still a lot of cases among the younger populations.
Thanks. And Governor, have you been told of any arrests of Connecticut residents who participated in the invasion of the Capitol and the riot down there last week?
I have not been told of any arrests. No, Ken.
Okay, thank you.
The Hartford Current.
Hey everyone, I wanted to ask some questions about the bigger picture of Connecticut's rollout. So we've seen some states that have taken sort of a hardline approach, threatening fines and saying if you violate a single priority group, bad things will happen to you. And Governor, your approach has seemed to be a little bit more light and hands off. Why have you decided that that is the appropriate approach?
Because I don't think it worked. I mean, I saw what they did in those states where they said, come one, come all, first come, first serve, anybody over the age of 65. And I think it's been a bit of a disaster, and it's led to an awful lot of confusion and frustration. And by the same token, I think you've seen sort of the heavy hand and very narrowly determining who gets vaccinated, who doesn't, has tended to slow things up. We did a chart, the other day just saying, I think working with Pat Charmel, working with our healthcare providers, trusting them to make the right decisions, giving them a little leeway so we can get the vaccines out as fast as we can. Now, coupling that, as Josh said, with any vaccine that's left over, we're going to make sure those 75-year-olds get first access to that. I think we've got a reasonable balance going forward.
So obviously some people are always going to raise the concern about, the quote unquote wrong person getting vaccinated at the wrong time. What is your response when people are concerned about that kind of thing?
I think it's a slight concern. Much more important to me is get those first-tier people vaccinated as quickly as we can. I think we've done a pretty good job of that. And I think the people of Connecticut aren't doing games and end running and trying to cut the line. At least we're tracking that, but we're not tracking that with heavy fines. We're just working with people.
And then I also wanted to ask you, as we move ahead to people 75 plus, will that include people who are in state facilities, including the Department of Correction, the Department of Mental Health and Addiction Services, the Department of Developmental Services, et cetera?
Yeah, I'm not sure we're going to determine that by age. I think those are congregate settings where it's probably a lot more efficient to vaccinate everybody in that group home or that correctional facility when their time comes up. Yeah.
So you wouldn't, somebody might say that somebody who's 75 plus and in a congregate setting is sort of doubly vulnerable or doubly at risk, but they wouldn't be moved ahead with the other 75 plus people.
Do I have that about right, Josh? What do you think?
Yeah, you do, Governor. We're going to be working in parallel, as we get it into phase 1B here with the other prioritized populations, which include congregate settings. In fact, the state has contracted with Griffin Hospital and Pat and his team to do a lot of the vaccinations for state employees and state facilities. So I let Pat comment there, but we're going to be working it as fast as possible to get in. And the governor's exactly right. It's much more operationally efficient, as you can imagine, not to go into a correctional facility, do 5 or 10% of the population, then come back a couple weeks later to do the rest. We're going to do it all in one go. That's how we continue to move as quickly as possible here. And Pat, any thoughts?
No, Josh, I agree. I think, the approach there is just to make sure that it's well orchestrated, and we've gotten good cooperation with agency leadership who've identified individuals, which has allowed us to go in and to vaccinate folks efficiently and get as many people done in as short a period of time as possible.
Thank you.
CT News Junkie.
Thanks, Max. My question is for Pat.
Yes.
Pat, explain, a little bit about why flu cases are down 95% this year.
So obviously, social distancing has helped. There's a belief that mask wearing is helping as well. So we're not only seeing fewer flu cases, we're seeing less respiratory infections just in general, which may prompt the wearing of masks in the winter months after the pandemic.
Okay. And Governor, I know it's hard to say because if everybody's a priority, then nobody is a priority. But I received a compelling phone call from a woman today who is terminally ill with cancer, but is under the age of 65. Is there anything, being done for that special group of people, cancer patients who have probably been very isolated and unable to see their loved ones during this time?
Well, I guess two questions there. One, where would they be in terms of vaccinations, and those that are obviously at the greatest health risk are priorities. And secondly, when it comes to seeing loved ones, we're doing everything we can, Christine, to make that possible. And, depending on the severity, we can make that even more possible.
Is it possible, though, that people with pre-existing conditions who are at greater risk of getting this virus, that they would be, where do they fall in the vaccination order, I guess?
Well, we're going to hear that from the Allocation Committee as soon as tomorrow. Josh, do you want to opine on that?
No, that's exactly right. It's one of the many very challenging trade-offs that committee is weighing. The CDC has put out a list of high-risk medical conditions that are they recommend are kind of prioritized for consideration, and those do include cancer, chronic kidney disease, heart conditions, sickle cell, type 2 diabetes, and a number of other conditions that may cause people to be at much higher risk of severe illness and death from COVID. And so they have that list. They're looking at that and weighing it against all of the other priorities.
Great. Thank you so much.
The Waterbury Republican American.
Thanks. I'd like to follow up on a question Sue Haig, the AP, asked. When in terms of the 75 and older, are you including uncompensated caregivers of individuals who are 75 and older?
What do you think, Josh?
Not at this stage. It's strictly based on age to start with here, and then we'll continue into other populations. Would they be possibly a later group in 1B, or would they be 1C, or? It is another group that the Allocation Committee has been looking at very carefully. Yes, people who care for someone, oftentimes a family member, right, who's elderly or at high risk, and they're going to have to be in their home. They're going to have to be helping that person, and so it's certainly something they're considering. But for now, this first start to phase 1B, really starting with everyone who's 75 or older. Okay, and also following up on another question that Sue asked, I'm not clear on how seniors who are living independently, who haven't required hospitalization lately, are going to be contacted. Obviously, we have giant medical groups here associated with a number of our hospitals. So I'm just wondering, how are seniors who live independently going to be notified when they haven't had any sort of requirement to go to a hospital?
So let me try that again. I want to make a distinction between those that have had a hospital encounter, and that could be either inpatient or outpatient. It could be something as simple as having a lab test where their lab specimen came to the hospital. But we have a large integrated physician practice with over 80 providers. So between 70 and 80% of the primary care that's delivered in our region is being delivered by providers that are part of our integrated physician group. So we're looking through their registration and medical record system as well for anybody who's at a physician office encounter in the last 2 years, and we can go beyond 2 years. So seniors tend to use health services, at least the over 65 population, at a rate 4 times that of the under 65 population. So chances are they've had multiple encounters during that 2-year period, either through a physician office or with the hospital. So we'll get the vast majority of individuals 75 and older in our community just through that alone, not without leveraging relationships through our anti-poverty agency, congregate housing, local clergy, social service agencies, the health department. So we're pretty sure that we're going to get most of them just looking at our own information, but we're not stopping there. And I know that other hospitals aren't either. Yeah, and if I could just also reiterate that, the hospital systems and other providers, federally qualified health centers, local health districts, that outreach that Pat's describing, that is not going to be the only way that you get an appointment, right? So, they're getting out in front of this. They're helping to do the outreach. But as the governor said earlier, on Thursday, we'll give you a website and we'll give you a phone number that if you want to book your own appointment, independent of that, and see what spots are available around the state, you'll have the ability to do that completely on your own. So this is a multi-pronged approach here to make sure that we're doing this in an orderly fashion, appointment-based, but anyone who's interested and wants to take any initiative at all to find out how to book an appointment will have a lot of clarity on that by Thursday.
Josh, given the difficulties, well-documented difficulties with the unemployment system, granted large due to outdated computer equipment. But has there been, have you done any kind of sort of stress test on this platform to ensure that it'll be able to handle the volume of calls and online requests and inquiries?
It's a good question, Paul. It's a little bit of the reason that we're taking the approach that we are, right? That we're leveraging our provider partners who are doing some of their own outreach. That'll address a large percentage of the population out there, so that by the time we turn on the URL and we turn on we provide the phone number, that there's less demand crashing down on those sites all at once. Look, that said, I'm sure there'll be some bumps in the road here. There's a huge demand and interest in vaccinations in the 75 and older population. We know that, and that's great. And we look forward to meeting that demand as quickly as we possible. But as the governor said, we're going to need to ask everyone's patience here. The website, anytime you have to learn a new website, it's always a little less intuitive than you might hope the first time around. So we're going to have a phone number as well, and some helpful people who can help navigate the appointment process if needed. But we're going to need people to hang in there with us a little bit.
Okay, and just one final question. Earlier today, this I guess for the governor or perhaps Paul, Senator Murphy had a news conference at the Capitol, and during it he mentioned that he was going to be having a call with a special agent in charge of the FBI in Connecticut. Has the administration, either the governor's office or the Department of Emergency Services and Public Protection, are they doing are they having the same sort of briefings from the FBI?
Yes.
How often?
The frequency has increased based upon the activities that occurred last week in Washington, D.C.
Okay. Thanks very much.
The Connecticut Mirror.
Thanks, Max. Governor, I had two questions, one healthcare and one transportation. When it comes to the vaccine rollout, I definitely heard what you and Josh said about the website and the phone number. Do you know, though, if other hospitals, or do you expect most hospitals, are going to be doing like Griffin and getting involved in this community-wide outreach? And also, is there any role for family providers to play, just because a lot of people out of habit may be turning to their family providers?
Yeah, I'll start with that, then maybe Pat can help out. But the answer to that is yes. What Griffin is doing is a model, but I think you're seeing that across the board. We got to go reach out to many of these underserved populations, make sure, just like we did with testing, when it comes to vaccination, we reach out to them. We bring the test and the vaccine to you. We reach out to you online, as Joshua said. We reach out to you by telephone, reach out to you through your houses of worship or other associations you may have. And I think that's really important to make sure that nobody gets left behind. You want to follow up on that, Pat?
Yeah, so we know, I'm familiar with what Hartford Healthcare is doing, what the Yale New Haven Health System is doing, and with federally qualified community health centers, probably the best example, which is Community Health Center based in Middletown and their network of centers throughout the state. They're doing things very similar to what I described. Each of us use a little bit different approach, have different relationships in the communities that they serve, but it's going to be that comprehensive approach that I described.
So just to clarify, if somebody just out of habit calls their family doctor, Pat, the family doctor, probably the best thing they can do is either refer them to the local hospital or refer them to the website or the phone number the state's going to set up.
That's exactly right. So we're communicating with local physicians about the approach that we just described, so they'll be aware of where to refer those individuals. For most of the physicians in our community, we're actually acting as an extension of their practice. So when those phone calls go out, it would be coming across as the practice calling to let those individuals 75 and older know that we have this testing capacity and we can get them scheduled. So again, that's one of those relationships that we want to leverage. The hospital's relationship with its local provider community, including both employed and independent physicians. So you're making a great point. We want to make sure they're included in this effort.
Thank you. And Governor, on transportation, your budget office has the transportation fund insolvent in 3 years. If we get through this session and nobody has adopted, whether it's tolls or gasoline tax increases or some new form of revenue for the transportation fund, the next step is just likely to be that we start stretching out when we go to Wall Street to borrow money for transportation, and ultimately projects are going to lag. So that's why I'm wondering, do you plan to start the ball rolling in February and propose some new source of revenue for transportation, even if it's not tolls?
Yeah, I mean, we knew that the transportation fund was running out of dough last year. You could just, see that. It's been accelerated due to COVID and people driving less and the low price of gasoline. We made a couple of proposals last year. You may have heard about them, Keith, and they were tough and they were hard decisions, and legislature didn't want to make a hard decision. So my job this year is to give them some other ideas that would make this fund solvent so we can go forward. In the meantime, we are going to get probably a couple $100 million from the feds for transportation-related assistance. So we have a little bit of time so we can manage through this, but legislature is going to have to make up their mind on this.
Just to clarify then, you do intend to give them some revenue-raising ideas for transportation in your February proposal?
I do.
Thank you.
The Day of New London.
Hi, this is probably a question for Josh. Going off of what you said earlier, you were talking a bit about, the conditions that the CDC considers high risk in terms of, cancer, type 2 diabetes. I had gotten a question from a reader who had noticed that during the allocation subcommittee meeting last week, they had a slide with those conditions that were considered high risk, but not some conditions that the CDC said might be considered increased risk, such as asthma, hypertension, cystic fibrosis. So this might be a better question for the subcommittee, but I don't know if you have a sense of, if that was intentional, if they're just focusing on the ones that CDC is confident poses a higher risk, and kind of how that's working in terms of breaking out different conditions, both in phase 1B and after that.
Yeah, I think it is a good question for the allocation committee. I think they are aware of that and are weighing that as well. But as the governor mentioned earlier, kind of building off that initial CDC guidance. Well, one other thing, if I could just add quickly, building on Pat's last answer too about doctors. One thing just to be clear here, don't call your doctor. They don't have vaccine in their office. They're not going to be able to help you get an appointment. So, this needs to be done, initially as an outreach through the providers who are actually doing vaccinations, as Pat has indicated. And then ultimately on Thursday, we'll give you a phone number you can call and a website you can go to. But we want to be careful that we don't have doctors getting inundated right now with phone calls about, hey, can you help me get my vaccine? They can't. That's not how the process is going to work, at least at this stage. Maybe further down the line, but keep in mind these doses of Pfizer come with 5 to 6 doses per vial. Moderna's 10 or 11 doses per vial. So it's not like a single use that's easy to administer in a doctor's office. We may get there further down the road, but we need to have critical mass and scale where we're providing these vaccinations.
And then I also had kind of a few questions together around the vaccine adverse event reporting system, VAERS. I was wondering if any of you could just kind of give some guidance. I know there's people who decide to go look at that, but at the same time, it's not really verified. Anyone who wants to submit an event can do so. And I think people are hearing about it a lot more now, so that might be part of the reason why there's more events being reported, whereas it maybe wasn't as well known if people are reporting, for other vaccines. So I don't know if any of you can kind of talk about, how to, if the public is looking at that, how they should interpret that data and what kind of the different caveats are.
Do you follow that, Josh?
I'm sorry, which data?
VAERS, the Vaccine Adverse Event Reporting System.
Yeah, I'm not quite sure how to answer the question. Pat, is that something no?
I think we got to get back to you on that one, Erica, but what we will.
Okay.
But let me answer your other question. I'm 67, I got a slight asthmatic condition, and where am I going to be on the priority line? And I will tell you that we've had a lot of conversations with the Biden task force, and I think you're going to find, starting in the next few weeks, they will be a little clearer and more prescriptive than the outgoing task force has been. So right now we're putting a lot on the shoulders of our allocation committee to make these choices. I think you're going to see, further inspired by science and health, that the COVID task force from the Biden administration will be quite clear on this over the next month or so.
Thank you.
All right, I'm getting the signal here. I was struck by Christine's question to Pat Charmel. Pat, thank you for joining us, talking about flu. And I was reminded that it was about 9 months ago that the Surgeon General came up here to our state. And it's just a reminder of how much we have all learned. The Surgeon General came up and told us, Pat, this COVID thing is probably going to be like, quote, a bad flu season, and masks may be more trouble than they're worth. Well, I think given the nature of Christine's question, this is obviously a lot worse than a bad flu season. We've had over 6,400 fatalities in our state. But with 95% fewer flu incidents, which just reminds you it works. Make a difference. Thanks, everybody.